Good morning, everyone. Welcome to TeleShadowing. We're live streaming this session to YouTube. Please feel free to ask questions in the chat box as we go along and they'll be addressed. I'm honored to introduce our mentor for today, Dr. Cheema. Dr. Cheema is an accomplished internist. She completed her internal medicine residency at the University of South Florida. She's a mentor to students and a published author in neuroendocrine tumors and infectious diseases. Dr. Cheema participates in community services and believes in health for all. She's also running a charity clinic for low-resourced patients. Now I'd like to request Dr. Cheema to begin today's session. Thank you.
Very good morning, everyone. Thank you for the introduction, Minahil. I really appreciate it. So today we are going to talk about a review a case study that is a very common medical condition, and it is extremely important to learn about it, and we all should know about it. But I would like this session to be more interactive, and I would like participation. If you don't know, it's okay. Just give your best educational guess. Just try your best. And the reason I'm asking you, because you will brainstorm, you will think about it, and it will help you why you are thinking this way, what's your thought process. And as we are learning life sciences, so let's start first with life. What is life? Let's see how many responses we have. So what do you think? What is life all about? Okay, life is a gift. Okay, all right. So the reason I'm asking, as we're learning life sciences, so we should start with basics. What is life? So life is a beautiful and precious gift given to us. It's basically a time period given to us from birth till last day of our life. And the big fact of the life is that we all have to leave one day. And life is like a piece of ice cube, and it is melting every day. So we need to try our best to make best use of this time and put this ice cube to make your water cold and help someone else to make their cup of water cold and drinkable for others as well. So basically, value this life. We need to value this life, this time period given to us. And we know the purpose of our life. What is the purpose of our life? So let's see if we can get few responses. What do you think? What is the purpose of life? I can share with you, once there was a very good session going on. There were a lot of physicians, lawyers from all different fields from different walks of life. They have a high IQ. And it was asked, what is their purpose of life? They were all in their 60s and 70s. And the one top physician who was very successful in her career and everything, and he started crying. So when it was asked why you are crying, so he said, I never thought about it. I'm in my late 60s, I'm going to be 70, and I never think about what is my purpose of life. So it's extremely important that we should know our purpose of life. And no one can tell you what is your purpose of life. It's only you and you. But we can talk about some principles that can help you, that can give you a yardstick so you can measure your purpose of life. And there is a very good book, Ikigai. It's a Japanese concept that teaches us how to live a long and happy life. And I will share more about it. Basically, it tells, find the purpose of life, improve your skill sets to follow your passion, and help others by listening to them and find solutions of today's world needs. So I can give you a few seconds and just think about it. What do you think is your purpose of life? Let's see if we get any response. As I mentioned, just try your best. So we need to live a purposeful life. We need to live a life that is purpose-driven, full of meaning. So it's basically a question of philosophy. It's very hard to generalize because we all have different backgrounds. There are different factors that determine our purpose of life. So we got few responses. Let's share. All right. So to love. Okay. So Anna said to love, the purpose of life is to share happiness with others. Okay, good. To serve others, the purpose of life is to help as many people as possible and give to others, to live a genuine life while helping others. Okay, great. All are great responses. So as I mentioned, no one can define your purpose of life. So we all are unique. Like we have different tone, different voice, different talents. We have different genetic background. Our nurturing is different. Our parenting is different. Our education level is different. Our religious beliefs, our thought process, our social setup, our financial system, and a political system we live in. So we all are different. So there are different factors that can contribute to define your purpose of life. So based on the literature, we can determine the yardstick, how you can make your purpose of life. So I can, as I mentioned, I cannot tell your purpose of life, it's only you and you, but I can tell you just basic principles. Before mentioning that, I will go over the levels of living. So literature shows that there are 3 levels of living. First is body level, heart level, and spirit level. So what does that mean? So body level means that we need our basic necessities. We need food, we need shelter, we need home, we need properties, we need cars for go to work, for education, right? So they're all basic needs. So this means we are living at our body level. We have met our basic needs. So what is the outcome? If we keep living on the body level and we don't go upper level, because all animals are doing the same thing, right? They eat food, they go sleep, they reproduce. So they are fulfilling their body needs, but we are superhuman, we are super creatures. So we have to be, after meeting our body needs, we have to go a super level. We should try our best. The next level comes a heart level. So at the heart level means feelings, ethics, morality, our values, the higher values, the philosophical ideas. So there, when we are at the heart level, we feel for others. They don't want to hurt others. They try to help others as well at their level best. And they follow their ethics, what is right, what is wrong. Their morality is honesty, truthful, manners. And they live beyond their life. They feel for others as well. So from body to heart level is a quantum leap. So we need to make sure there's nothing wrong to be living at body level. But being a super creature, we should think big, think out of the box. So we need to see how we can help others as well, feel for others as well, and what can we do? So heart level is not just materialism. We choose the people who are living on the heart level, they choose values over the materialistic stuff. They save relations. They start humanitarian projects. They feel good to give to others. They walk their talk. And the next level is the spirit level. So spirit level, they are the people, they are very creative. They are the leaders. They have a creation of aura around them. They create the goodness, they create the happiness, they create values. Why? And they create aura around them that everyone want to be in that aura. They want to learn how to go in that level. They have electromagnetic field around around them. And they are in the leadership role. So how do we know that? They don't discriminate. There's no discrimination. They don't say this is good, this is bad. Of course, there's some people, their actions are bad. They don't consider human beings are bad. Their actions that need to be taken care. So they don't have duality in their responses. And they are beyond the praise, beyond the criticism. It does not impact them. They just keep on moving. They keep the creation. They keep on working on the creativity as much as possible. So at times there is an overlap between the body and heart level. And there is no clear demarcation that it can interplay as well. Sometimes we're at body level living, sometimes we're at heart level. But ask yourself where we stand, where you stand. So at spirit level, you don't lose anything. their problem is to help others, to add values in others' lives. So I can share 4 principles that you can use, you can apply, and you can see, and you can define your purpose of life. It will make your definition will be easy. It will make your goal easy. How to define your purpose of life. So first thing is, your purpose of life should be objective driven. It should not be subjective purpose. What does that mean? For example, I want to lose my weight. It's subjective. So what I'm supposed to do, I have to walk, I have to work on my diet, right? So that is a subjective purpose. And the objective purpose is not measurable, it's not visible, it's intangible. So just keep in mind, your purpose of life should be objective. And secondly, your objective should not be your need. And then third, you can define objective should not be time bound. Purpose should be timeless. And the last but not least, objective should be noble. The effort you put to achieve your goals is not just for beneficial for your close relatives, it's for everyone around, for humanity. So these are all the yardsticks you can see where you stand, what is your purpose of life, and it will help you to define your purpose of life. All right. And there's I would like to, every time we take the ride of internal medicine, there's a very favorite slide. I talk about what is self. So I talk about it multiple times. Now I will ask you guys, and you will teach me what is self, what is self-care, what is well-being. Let's see if we get some responses. Let's see if you guys are taking care of yourself. Let's see if we get any responses. Okay, how I view myself and my priorities in self-care. Okay, but I would like to know, did you implement one goal in self-care? So basically, self is a person's essential being that distinguishes from others. So we all are unique. And self-care, so every time we talk about 4 domains. So I will go over pretty quick, the take-home points, the physicality, just 4 things pretty quick. Be compassionate with your body first. It includes 4 things, your diet. We are what we eat. Make sure you're eating diet. Diet includes 6 things: carbohydrates, proteins, fats, minerals, vitamins, and water. There's nothing else body considers as a food. So please make sure you have an adequate nutritious diet. And then your sleep hygiene is very important, exercise, stress management. And most important thing to manage your stress, forgive everyone before you go to sleep. So this is how you can fulfill your physical health quotient. And then emotionality. What is emotionality? It's basically it's the thoughts and emotions. It's basically it's our emotions that produces the shadow. It's called emotions. And if, for example, if you have a good thoughts about me, you will have a good emotions about me. But if you have a bad thoughts about me, so emotions will be accordingly. So basically, emotions by definition is nothing itself. It's basically the shadow of our thoughts. And if we want to grow our emotionality, we need to work at the level of thoughts to manage our thought pattern process. And then if you get angry, you can you can manage your anger. But the thought that giving you the anger, you have to manage that thought first. So take home point to manage the emotionality is don't catch other people's words. The one who holds the other people's words are not emotionally sound. And also think first, then feel. So these are 2 important points I will mention, and I will move on. And then I will go over the intelligence. What is intelligence? So intelligence doesn't mean the body of knowledge. It is related to the possession of knowledge, our skills, our attitude to solve the problem, to face the challenge, to get out of the challenge. So how we can do that? Just learn, focus, live in the present moment, focus in the present moment and power of now. That's very important. You can improve your intelligence. All right. So then we have spiritual health. So what does it mean? It's not like religious exercises. It's not religious beliefs. It means why I do what I do. So you have to ask yourself. It's only you and you who can answer. So why will determine our spirituality? All right. So let's stop here. And I will say, please make sure you're taking good care of yourself. Take time for your self-care. And then you will be able to help yourself, and then you can help others. All right, so let's go over our today's case study. This is a disclosure. The information is for educational purposes only for the students. Please do not use this information for treatment of any medical conditions. This is not a substitute for any medical advice. So please, you should not disregard your physician's professional medical advice or delay seeking any care because of something you have learned in this simulated patient case studies or case studies we will do. And remember, call your doctor on 911 in case of any emergency. All right, so today's case, let's talk about. So there's a 50-year-old female with no significant past medical history, presents to urgent care with complaint of headache, feeling of pulsation in head and neck, nausea for last 4 days. All of the review of system is negative. Patient smokes 1 pack a day. Vitals, I can share with you, pulse 84, blood pressure 160/100, respiration 18, oxygen saturation 96%, temperature is 98 degrees Fahrenheit, BMI is body mass index is 32. So what do you think is going on with the patient? I would like the differential. So you can go over 50-year female, patient has symptoms, headache, nausea, feeling of pulsation, head and neck, and patient is a smoker. She smokes 1 pack a day. So what do you think? Let's see if we get any response in the chat box. So please participate. Doesn't matter if you don't know, just try your best. There's no wrong and right answer. We are all here to learn. Let's see if we get any response before we move on. So differential diagnosis, I would like to know what's going on with the patient. So next, please. So what do you think? Blood pressure is a little high. High blood pressure, okay, good, yes. So Venkat said blood pressure, high blood pressure, good. What else? Okay, seizing disorder, yes. Anna mentioned. Anyone else, any other responses? Okay, all right, let's move on. Early signs of heart attack, okay, good. Cardiac event, okay, good. All right, so all are good. They're all good responses. So yes, so this patient has symptoms. And you can see in the vital signs, there was a blood pressure. It was high. So first of all, we'll go over what is blood pressure, first of all. So let's go over what is blood pressure. Does someone know what is blood pressure? I would like participation. Let's see if we get any responses. So what is blood pressure? While you're typing responses, I can just share it's a force of circulating blood on the walls of the arteries is called blood pressure. So when the heart pumps blood through the arteries, the blood puts pressure on the arterial walls. That pressure on the arterial walls is the blood pressure. And when we talk about checking the blood pressure, it means we want to check 2 numbers, represent the force of the blood that heart pumps through the body. So like this is the heart and it pumps, squeeze, contraction of the heart. This means it's pumping out of the blood from the heart. So you can go all other parts of the body. So there are 2 numbers. Let's talk over briefly about these 2 numbers. The 2 numbers are called the systolic blood pressure and diastolic blood pressure. So these numbers are measured by using a cuff, blood pressure cuff. We'll talk more about it. And these numbers can be read by a machine. I will ask you what we call it. And the person hearing the pressure rise and fall through a stethoscope. So let's go over these numbers. So when the heart beats, the blood pulses through the arteries to travel throughout the body, to all parts of the body. And it is not a steady stream you might see from a garden hose or water faucet. And the pulse of the blood flow and the pressure it exerts change from moment to moment. And it's highest during the heartbeat when heart contracts. This is the systolic pressure. So when heart contracts to pump the blood out of the heart is called systolic. It's called systole. That event is called systole, and the pressure is called systolic pressure. And the lowest number, the 80 number you can see, is between the beats. It's called diastole, when heart relaxes. So like this is the heart, if you see, you can see this is the heart. So this is contraction. Now heart is relaxing. So this is called diastole. So the pressure is called diastolic pressure. So the blood pressure reading includes both these measurements. And so we measure the blood pressure in these numbers so that is a standard way of describing the force of the pushing blood. Both the systolic and diastolic pressures are extremely important. So these numbers you can see over here in the format of 120/80. And the systolic blood pressure is the higher number. The top number is systolic, and the bottom number is diastolic blood pressure. So as we mentioned, the systolic blood pressure, when the heart squeezes, when heart contracts, when heart beats, is called systole. And it's the top number 120, and the bottom number when heart relaxes. When heart relaxes, the deoxygenated blood comes into the heart. It's called diastole, and pressure is diastolic pressure is the bottom number. All right. So if we summarize, so these two pressures, systolic pressure is the top pressure, diastolic pressure is the bottom number. And this is how we measure the blood pressure when we check. So how do we check the blood pressure? So basically a blood pressure we check by placing a stethoscope on the arm of the artery. So there's a machine I mentioned, we will use sphygmomanometer. So there are different parts of it. You can see over here, there's I can show you here, there's an end valve, there's a bulb we can push, pump the air in. This is a tube, this is the cuff. We can wrap around the arm. And this is the aneroid manometer. So blood pressure is by placing the stethoscope on artery and pumping up the cuff around the arm. What is the purpose of doing that? The blood pressure is basically we read on a special meter called sphygmomanometer. And the measurement technique, next please. So there are different types. I can show you, this is the mercury one. And the next one, this is the aneroid. You can see with the needle, that one's with the mercury. And then we have digital ones as well now. So how do we measure it? So there's a very good technique. First of all, for an accurate diagnosis of hypertension to be made, it is essential to properly measure the blood pressure. And the technique we use should be appropriate. So improper measurement for blood pressure is common and can change the blood pressure reading up to 10 millimeter of mercury. So we have to be very careful. So the mmHg number that you saw before is millimeter of mercury. So which can lead to the misdiagnosis. So if this technique is not proper, is not appropriate, so we can misdiagnose. And the misclassification of hypertension as well. I will go over different stages or different classification of hypertension as well. So accurate blood pressure measurement technique involves several steps. First of all, proper blood pressure measurement requires a person whose blood pressure is being measured to be sit quietly for at least 5 minutes, which is followed by application. Next, please. So by application of a properly fitted blood pressure cuff. So there are different sizes of the cuff. I can show you over here. See the different sizes. There are adult sizes, there's pediatric size, the infant sizes, and neonate size. So there are different sizes of cuff. So we need to make sure we are using the right cuff to measure the blood pressure. And the patient should be seated comfortably, their back supported. Go back to the next slide, please. Yes. And their feet flat on the floor with their legs uncrossed. And the person whose blood pressure is being measured should avoid talking or moving during this process of checking the blood pressure. And the arm being measured should be exposed on a flat surface at the level of the heart. And the blood pressure measurement should be done in a quiet room, so the medical professional checking the blood pressure can hear the Korotkoff sounds. I will show you the little video how it sounds like. So while listen the brachial artery. So I will show you the next, please. So what we do, next, please. No, go back, please. So over here, next, please. Yes. So this is the brachial artery. This is the cuff we apply on the upper arm. Then this is the brachial artery. We squeeze. This is the bulb. And then we fill the air in this cuff. And then we block the brachial artery. And then we slowly release the pressure. And then over here, you can see there's no sounds. And then there's first sound heard is called, it's the systolic pressure. So we note that number. This is the manually, when we check the blood pressure manually, I'm telling you that, of course, we have digital ones available these days as well. So this is how we check the blood pressure. So first sound we hear is called systolic pressure. And then when the artery is fully open, completely open, then when there's no sound, it's considered as a diastolic pressure. So we have to be very careful listening to those sounds. And so these Korotkoff sounds are generated when the blood pressure cuff changes the flow of the blood through the artery. And these sounds are heard through, we can hear by the stethoscope or a Doppler. That is, we can place on the distal to the blood pressure cuff. And I will show you a little video how we have these sounds. And this is the named, so please turn on the, yeah, so listen to these sounds. Go back next slide. All right. So these are the Korotkoff sounds that medical personnel can listen. And these were named after a physician who discovered them in 1905. So blood pressure cuff should be deflated slowly. Back slides, please, again. So as I mentioned, when we were making the other one, please. Yes, so blood pressure cuff should be deflated slowly, about 2 to 3 millimeters of mercury per second while listening to these sounds. And multiple blood pressure readings, at least we can space them apart 1 to 2 times apart, should be obtained to ensure the accuracy. So this is how we measure the blood pressure. All right, so let's talk about the blood pressure regulation. So what are the mechanisms? What is the physiology? How we, there's a blood pressure regulation in our body system. So basically, there's a changes in blood pressure are routinely made in order to have appropriate amount of oxygen and nutrients to specific parts of the body. For example, when we do exercise, so our body demands an additional supplies of oxygen to the skeletal muscles for the blood delivery and to supply the blood supply to these muscle increases during exercises. So there's some mechanism that help regulate the blood pressure. So the cardiovascular center that provides a rapid mechanism is called is basically the neural mechanism for the regulation of blood pressure. They are the baroreceptors, they are the sensory neurons, and they're the chemoreceptors. Basically monitor the levels of CO2 and O2, and these are two neural mechanism, baroreceptor, chemoreceptors, that can help to regulate the blood pressure. But the kidney provides the hormonal mechanism for the regulation of blood pressure by managing the blood pressure. And I will go over pretty quick, the two hormones, epinephrine, norepinephrine. I can show you the next slide. There's a blood pressure regulation by the epinephrine, norepinephrine. They are released from the adrenal medulla. So where is the adrenal gland? So I want to show you, these are kidneys, right kidney, left one. And these are the right adrenal gland, left one. So the inner portion is called adrenal medulla, outer portion is adrenal cortex. So epinephrine and norepinephrine released from the adrenal medulla. So these are two hormones that help with the blood pressure regulation. So now I'm going to talk about the renin, angiotensin, aldosterone system. What's that? So one of the coolest aspect of this renin, angiotensin, aldosterone system is that it involves multiple organ system. It involves the liver, it involves the lung, adrenal glands, kidneys, and vasculature. So these are all very extremely important. So what is this system all about? So the renin, angiotensin, aldosterone system of the kidneys regulated the blood volume basically. And in response to rising the blood pressure, there are the JG cells in the kidneys called juxtaglomerular cells in the kidneys that secrete the renin into the blood. So you can see over here the kidney that release the renin into the bloodstream. And then renin converts the plasma protein angiotensinogen into angiotensin 1. You can see over here. So this is the renin that convert angiotensinogen into angiotensin 1. And this angiotensin have two mechanisms. So angiotensin then converted angiotensin 2. How it happens. So then angiotensin 1 converted to angiotensin 2 by the enzyme released from the lungs, angiotensin converting enzyme. So then angiotensin 2 have two ways to monitor this system. So how it does that? So angiotensin 2 constrict the blood vessels. First of all, you can see over here, the systemic vasoconstriction. So they constrict the blood vessel. So it has a direct effect. They constrict the blood vessels and reduce the amount of blood delivered to the kidneys, which decreases the kidneys' potential to excrete water. So it causes raising the blood pressure by increasing the blood volume. So angiotensin 2, second mechanism, stimulates the adrenal cortex to secrete the aldosterone. So aldosterone is released. This is the hormone that reduces the urine output by increasing the retention of water and sodium, and by the kidneys. So these are how it works. Like angiotensinogen have two effects. One of the ones on the systemic vasoconstriction, other on the cortex that releases the aldosterone, and the aldosterone works on the kidneys to help with the sodium and water retention. All right. So there are other factors, there are other substances that can be used as a ADH, antidiuretic hormone. There's a ANP and nitric oxide. These are all other factors that can help with that influence the blood pressure. Okay, all right. So what are the disorders of blood pressure? So as we mentioned, the blood pressure is the one when they apply the pressure on the walls of the artery, the blood vessel. And when there's a disorder of the blood pressure, controls include the high blood pressure or the low blood pressure. So when there's when the blood pressure is exerted by circulating blood vessel against the walls is too high, is called hypertension. And the condition in which the force of the blood against the arterial wall is too high. And I told you the number, the normal number is 120/80. And the blood pressure that apply this force against the blood vessel wall over the inner walls of the arteries. And when it's more than normal, I will show you different ranges. It's called high blood pressure, or someone mentioned when we're asking what's going on, someone mentioned high blood pressure. So hypertension. So this medical condition is called hypertension when there's a high pressure of the blood against the walls of the arteries. And the high blood pressure is classified as primary hypertension and secondary hypertension. So primary hypertension, and there are different factors causing primary hypertension and secondary hypertension. And first of all, I will go over the hypertension stages. So next, please. Okay, let's go over, I'm gonna quiz you guys. So what do you think, how many adults in the United States have hypertension? What do you think? So you have to 37%, 47%, 57, 67. Let's see. 57, 57, 47. Okay, good. 37, 57. Let's see. A few more responses. So Michael said 47%. Venkat said 47%. Good. All right. So yes, it's 47%. So let's go over the hypertension stages. So so this is the American Heart Association classified these, the different categories of blood pressure. So normal is less than 120, less than 80. And elevated is also called prehypertension as well, when the range is between 120 to 129 millimeter of mercury, and diastolic is less than 80 millimeter of mercury. And then it's called stage 1 hypertension. So stage 1 hypertension is when the systolic blood pressure is between 130 and 139 millimeter of mercury, or diastolic is between 80 to 89 millimeter of mercury. And there's a stage 2 hypertension when at least systolic blood pressure is more than 140 or higher, and or diastolic blood pressure is 90 or higher. So it's considered stage 2 hypertension. And then after stage 2, it's called hypertensive crisis, hypertensive urgency, when you need urgent care help at that time. And when blood pressure is higher than 180, systolic blood pressure, or when diastolic blood pressure is more than 120. So these are the hypertensive crisis situations that need to be taken care right away. So I will go over briefly the signs and symptoms of blood pressure. So blood pressure basically can have many symptoms. So hypertension has been labeled as a silent killer. And the long-standing high blood pressure can lead to multiple complications. We'll go over. And the main symptoms are headache, dizziness, shortness of breath can be the symptom, blurred vision, the feeling of pulsation in the head and neck, and nausea. So you can see in our case study, patient had a headache, patient had a feeling of pulsation in the neck, head and neck, and the nausea. So these are the symptoms patient had. And patient had a blood pressure when we read, it was 160/100. So let's go over the different, I mentioned about primary hypertension and secondary hypertension. So primary hypertension, most of the time, more or less also called essential hypertension, there is no identifiable cause of the high blood pressure. And this type of hyper blood pressure tends to develop gradually over many years, and it can result from complex interaction of the genes. It can be because of the genetic makeup, and environmental factors can contribute to it. And there's numerous common genetic variants that can cause this. And the other factors that can be modifiable factors and can cause risk factors that can cause a primary hypertension. Next, please. So there are modifiable risk factors and the non-modifiable. So modifiable is cigarette smoking, obesity, physical activity, dyslipidemia, diabetes, microalbuminuria, and non-modifiable is the age, family history, and gender. So age is a risk factor until as we age, at about age 64, the blood pressure is more common in men and then women. And of course, after age 40, our blood vessels get a little bit harder, and that also cause one of the cause of the elevated blood pressure. Then race is another one, and family history. Sometimes blood pressure runs in the families. And then being obesity, overweight, the more body you need to supply the oxygen, and you need more nutrition to your tissue, so that can cause high blood pressure as well. And the amount of blood flow through your blood vessels increases. And then when we are not physically active. So these are all the factors. Remember, I talked about self-care, same diet, activity. So, we can correlate these risk factors with our self-care as well. So if we will not care ourselves, we will end up having these medical conditions as well, right? So it's very important. I'm going to correlate the self-care with our today's case study as well. And then unhealthy lifestyle, like using tobacco, too much salt intake. Again, I will relate with the self-care, with the diet part, nutritious diet, make sure how much sodium intake, and then potassium intake, and too much drinking alcohol can cause it as well. And stress. And stress is a very important factor as well. And it leads to temporary increase in blood pressure, but stress-related habits, if we have continuous stress, such as eating, so when we get stressed, we have different coping mechanism. If we have unhealthy coping mechanism, so then it can have a bad effect on our health. So stress management is very important, as we discuss in the self-care as well. So please keep an eye on all these factors. These are risk factors for hypertension as well. All right, so secondary hypertension, and sometimes pregnancy contributes to high blood pressure as well. And secondary hypertension, so secondary hypertension results from an identifiable cause. There's some underlying condition that causing the blood pressure to be high. And this tends to be appear suddenly and can cause a high blood pressure. Then there's a primary hypertension. And the most common cause, underlying condition, is the kidney issues. Kidney disease is the most common cause of secondary cause of hypertension, and other endocrine conditions can cause it. So I can show you next, please. So endocrine others, there's a like Cushing disease can cause, hyperaldosteronism can cause this, aortic coarctation, pheochromocytoma is another condition, and the stenosis of renal arteries is another condition can cause. These are all secondary causes, and the hyperparathyroidism can cause this for secondary hypertension. All right. So as we mentioned, there are the variable conditions, and there's a modifiable risk factors and non-modifiable risk factors as well. So I will go over pretty quick with the white coat hypertension. How many of you have heard about the white coat hypertension? So what is a white coat hypertension? So what happens, this is basically hypertension diagnosed on the basis of a persistently high blood pressure, resting blood pressure. And American Heart Association recommends at least 3 measurements on at least 2 separate healthcare visits to diagnose hypertension. But in white coat hypertension, patient in the office setting, when patient comes to see the doctor, they have a high blood pressure. But in other settings, like intermittent ambulatory blood pressure monitoring, they have normal blood pressure. So we consider it as a white coat hypertension. So basically, out of office blood pressure is less than 140/90, and intermittent ambulatory blood pressure is good as well. Maybe more proper. So how we can diagnose the white coat hypertension? So intermittent ambulatory blood pressure monitoring is the right approach to diagnose the hypertension. So how we can diagnose hypertension? So basically, there's a American Heart Association recommendation. We can diagnose by measuring the blood pressure. As we said, sphygmomanometer we can use to measure the blood pressure. We have to at least take 3 resting measurements and at least 2 separate healthcare visits. And if it's high, then we consider it as a hypertension. Of course, a stage 1, stage 2, and they confirm if a clinic blood pressure is 140/90 millimeter of mercury or higher is considered as a patient has a hypertension. All right, so I will go over pretty quick the complications. So what are the complications when there's excessive pressure on artery walls? When it's the high blood pressure can damage blood vessels as well as the organs. So higher the blood pressure, the higher it gets uncontrolled, the greater the damage. So it's very important. It's a very common condition. As we go over, 47% of the population have high blood pressure. So it's very important to manage. And then I will go over the end organ damage as well. So uncontrolled high blood pressure can lead to heart attack, as someone mentioned in the chat box as well, right? So heart attack can cause the why heart attack? Because of the hardening and thickening of the arteries called atherosclerosis, which can lead to the heart attack. It can lead to the stroke, cerebrovascular accident, and then aneurysm. So increased blood pressure can cause your blood vessels to weaken. And when they get weak, there's a bulge in it. It's called aneurysm, and forming the aneurysms. And if aneurysm ruptures, it can be life-threatening. And then other condition can cause is a heart failure. So what happens when the heart has to pump blood against the high pressure in the blood vessels, the heart has to work harder. So this causes the walls of the heart pumping chambers to be thickened. So left ventricular hypertrophy is called LVH, or left ventricular hypertrophy, and basically thicken the muscle of the heart, and with pumping with high pressure, and it causes heart failure at the end. And what happens, sometimes there's with high blood pressure, I mentioned there's a monitoring the kidneys, the main regulatory system. So what happens, it narrowed in blood vessels in the kidneys as well. And they can prevent organs from functioning normally, because kidneys are excreting excrete the waste from our body. So it also narrowed the blood vessels in our eyes. So this can result in vision loss, can cause retinopathy. So there are condition in eye condition as well. The high blood pressure can cause it. And then it can cause it's a part of the metabolic syndrome. So this is a syndrome, basically is a group of disorders in our body metabolism, including increased waist size, elevated cholesterol levels, high triglycerides. Then there is a low HDL cholesterol. HDL is called good cholesterol, and the high blood pressure and high insulin levels. So these all make up the metabolic syndrome. And these conditions more likely to develop diabetes, heart disease, and stroke. And also there's a issue with the memories and understanding. Uncontrolled high blood pressure affect the ability to think clearly. And also it can cause dementia. So what happens, there's a narrowing or blockage of the arteries can limit the blood flow to the brain, and leading to a certain type of dementia, like it's called vascular dementia. And of course, stroke is one of the complications of the high blood pressure as well, hypertension, and it can interrupt with the dementia. It can cause vascular dementia as well. All right. So next, please, I will go over pretty quick the hypertensive emergency. So what is hypertensive emergency? So what happens, it means the blood pressure is so high that organ damage, the end organ damage can occur. So when blood pressure is more than 180/120, so it can cause end organ damage. It's hypertensive emergency with organ damage. First, it's called hypertensive urgency when there's no organ damage, but there's organ damage called hypertensive emergency. So blood pressure must be reduced immediately to prevent imminent organ damage. And organ damage associated with the hypertensive emergency includes, it can cause hemorrhage, stroke, it can cause retinopathy, it can cause peripheral vascular disease, it can cause coronary artery disease, it can cause left ventricular hypertrophy, it can cause renal failure, can cause proteinuria. So these are all the end organ damage with a high blood pressure, with the hypertensive emergency situations. All right, so let's go talk about the next, please. Okay, so patient presents with hypertensive emergency. In which setting should we treat the patient? Let's quiz you. Let's see if you guys are awake. Inpatient or outpatient? Okay, good. Inpatient. All right. Okay, so first of all, tell me why it happens. Why patient has high blood pressure. So why hypertensive emergency happens? So there, it can be possible the patient is non-compliant with his medications. That is the one possibility. Then dietary modification is a dietary lifestyle is not good. So that can cause hypertensive emergency, or the medication dosage is not appropriate. So these are all just inpatient. Yes, good. So we have good responses. You're right. So hypertensive emergency, we need to manage inpatient and make sure blood pressure is controlled appropriately to avoid any end organ damage. All right, so let's go over. So these are all, again, pretty quick slide. We'll go over when blood pressure is more than 180 over 120. So it can cause the multi-organ damage. It can affect the kidneys, brain, eyes, heart, arteries, lungs, acute kidney failure. So these all so it can damage any organ. So that's why it's very important. Anyone with a diagnosis of hypertension should have monitor blood pressure appropriately, medication compliance, lifestyle modification to avoid go into hypertensive emergency to avoid any end organ damage. All right, next, please. So prevention. It's always being said, prevention is better than cure. So much of the disease burden of high blood pressure is experienced by the population who's labeled as hypertensive, and the strategies we need to reduce the consequences of high blood pressure and reduce the need of antihypertensive medications. That's the first goal. So what we can do? So lifestyle changes, lifestyle modification are the first recommendation to lower the blood pressure before starting any medications. And basically, again, risk factors we talk about, we have to work on the risk factors. And how we can do that? Again, reduce the dietary sodium intake. We have to counsel the patient for stop smoking. We have to counsel the patient for alcohol consumption use. We have to avoid binge drinking, healthy diet. So again, you will see all this, and then physical activity, weight reduction. So these are all the modification if we go back and correlate with the self-care, right? So I'm gonna go back and forth, so you will take care of yourself as well to avoid, we think, okay, we are young, or not gonna happen, but it's called snowball effect. Small pieces pile up, and at the end, we end up on these medical conditions. So it's better take care of yourself from the beginning, have a good, healthy lifestyle, diet, exercise, sleep, hygiene, and stress management. All right, so these are all the lifestyle interventions we can do to help prevention and modification to reverse those changes and help the patient to bring the blood pressure within normal range without starting any medication. So these are the first we can do. So, and effectively lifestyle modification may lower the blood pressure as much as individual antihypertensive medication does. And of course, medication has a lot of side effects. So lifestyle modification is very important. Combination of two or more lifestyle medication can achieve better results. And there's an evidence-based study that reducing dietary salt intake lowers the blood pressure. And so there are a lot of evidence-based study available. And of course, a lifestyle modification we can see over here. Again, same thing we are repeating: physical activity, stress management, sleep hygiene, tobacco use, healthy eating habits, and relationship management. All right, because sometimes why we get stressed when we have some tension among relationships, right? It's very important to have a good relationship. All right, so let's go over briefly. I will go over the management. So common medications we use for the management of high blood pressure, we use the diuretics. We use beta blockers. But according to published review, published articles, the main reason we start medication to reduce the likelihood of complications and to avoid the end organ damage, like heart failure, we talk about renal failure, we talk about stroke. So these are all the we have to work on it to make sure to avoid any end organ damage. All right. So the medications we talk about, there's several classes of medications collectively referred as antihypertensive medications, treating hypertension as a thiazide diuretics, calcium channel blockers, angiotensin converting enzyme inhibitors, then angiotensin receptor blockers. So there are different classes of drugs we can use to manage the high blood pressure. And so these are all the different classes of drugs. Sometimes we need to use more than one drug to address the blood pressure. It depends on stage 1, stage 2. Of course, every time we see the patient, we address lifestyle modification. Then if we need to start a medication, we see the medication compliance. We see a patient is keeping the blood pressure home log at home. Patient is checking blood pressure at home as well. And if any red flags, patient is noticing blood pressure is running high, that need to be addressed. We need to adjust the doses of medications to help the patient to have a appropriate level of the blood pressure reading levels. And so in our patient, so patient came in, she doesn't have any history. So what will we do? How will we diagnose? So as I mentioned, American Heart Association guidelines, that we have to have two different settings to check the blood pressure. I can share you the USPS task force as well. Next, please. Do we have? Yes. So United States Preventive Service Task Force recommendations are that any adult 18 years or older without known hypertension. So these are the guidelines. We need, so we can, in the office setting, we can check the blood pressure and see if it's running more than 140/90, so stage 1, stage 2. Then we initiate lifestyle modification. If it doesn't help, then we move on to the medications. All right. Any questions so far? Okay. All right. So please skip this slide. Next, please. Okay. No, we have to move on. Okay, all right, next, please. Okay, now move on. We already talked about it. Let's see. Okay, all right. So last but not least, so every time we talk what is success, so everyone has their own definition of success, and basically is the goals we set for ourselves. Our main purpose is the make up the few simple disciplines we need to adapt to achieve our goals. So as I mentioned in my last session as well, your passion and profession should be the same. And your success and strength comes with passion. So when you're passionate about your profession, you will not work a single day. You will love doing whatever you're doing. So first decide what you're passionate about. So passion and profession should be the same. And perseverance. So why we need perseverance? Why we need grit? To keep you moving. So of course, passion is a driving force for progress, for your success. And whenever you're passionate about it, how do you know that? You are out of time and space. You keep enjoying doing that. It doesn't matter to you if you're gonna get paid for that or not. And you don't get tired while doing it. So these are all the signs that you're passionate about doing it. And so what is grit? So grit has a very significant role in success. And basically it's a passion and perseverance for long-term goals. And grit is basically developing the stamina to keep doing it. And grit is basically putting the effort day in, day out, not just days or weeks, just for the months, for years sometimes. And working hard, keep putting your efforts, continue doing that. And grit is basically, it's a marathon. You keep doing it till you achieve your goals. And the growth mindset. Growth mindset is very important. We need to keep improving ourselves in all areas of life, and in our physical health and emotional health, in our IQ level, we need to improve, our emotionality we need to work on. So these are all factors, as I talked about in the beginning of self-care, help you with your success. Because if you are not healthy, if you're sick, imagine if you have a simple cold, simple flu, you will get tired easily. You are not able to do your day task, right? So it's very important. It's extremely important to take care of yourself. when you will be able to take care of yourself, then you will be keep working on your goals slow and steady. All right. So of course, I can go over pretty quick. Of course, your habits make you, habits break you. So your healthy habits. So no one can predict your future. But one very wisdomful person said, if you want to know someone's future, look at that person's habits. So it's very important. Your habits matters a lot. And hard work is a habit. Planning is a habit. Dividing a day is a habit. Dividing your resources is a habit. So the planning make your effort less and make you more towards your goal. And value your time. That's very important. Struggle is a habit. Valuing your time is a habit. So these are habits are very important to work on. And last but not least is practice. There's no magic in this world. Everything is practice, practice, and practice. And never give up. So whenever you have any thought comes, we're all human beings, right? Sometimes I feel, oh, it's so tough. There are a lot of challenges in my life. I should quit. So at that time, think about it, why you started the first time, why you spent too much time achieving this at this point. I understand we will face challenges. There will be a lot of sacrifices, but that's how, when we see someone successful who have achieved their goals. So we just see the tip of the iceberg. We don't see the successes, the sacrifice. We don't see the sacrifices, the challenges, the failures. It's like an iceberg. We see the tip of the iceberg, right? So all the ice is behind the ocean. We don't see that. So everyone has gone through that process. So whenever you feel like this, just take a break and just talk to yourself why I started first place, why I'm doing it. If you're passionate about it, you will keep on moving. That's the goal. That's the way of doing it. I can tell you from my own experience. And most importantly, I will share self-talk. Self-talk is very important. It's being said there are two types of talk. The one we talk with other people, and then the one we talk with ourselves. So we spend most of our time with ourselves. So that's why we keep talking about self-care, about self-talk. So why self-talk is so important? Our self-talk is directly proportional to our success. So when we self-talk, we sometimes speak louder thoughts. So we keep talking, okay, I'm going to do it. So so you have to give yourself positive affirmations as well. Yes, I can do it. I will make it, right? We all are unique. God has gifted us multiple talents. We all have talents. We just need to find our talents, our strengths, and keep working, keep polishing our skills, keep strengthening our skills, keep strengthening our talents, and keep on moving. So it's being said, there's a 1% inspiration, 99% perspiration. So of course, hard work, effort, and definitely when you're so passionate about it, you keep working on it, perseverance, growth mindset, practice, 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 you will achieve your goals.
It's 11 o'clock.
All right, so I will stop here. I'm on call as well. And but I will like to see if any questions for me. I will be happy to answer. Let's see if we get any questions. Okay. Anytime you can, if you have any questions, concerns, you can email us as well. And I share my email in my private sessions as well. I think I didn't add slide this time, but you can, any questions, please feel free to contact us and keep on moving. And I will wish you all best of luck. Thank you, everyone.
Thank you very much, Dr. Cheema. We really appreciate you taking the time out of your day to mentor us.
Thank you.
I'd love everyone to please give a warm thank you to Dr. Cheema in the chat for this incredibly informative session. Okay, now we'll conduct our closing session with our quiz and future session dates. The link to the quiz for this session is now live. You'll need a 70% or higher to pass and receive a certification. Many of our students have expressed interest in pursuing leadership position in teleshadowing. We have reopened our leadership application for students interested in joining our team as well. The link for that will also be in the chat. Now on to our next session dates. These dates will also be posted throughout our social media outlets, so be sure to follow us at TeleShadowing. Our next session will be next Saturday, April 2nd at 10 a.m. Eastern Standard Time, excuse me, with our physician mentoring us in emergency medicine. Thanks so much, everyone, for attending today's session. We hope to see you in upcoming sessions. This concludes this week's shadowing session.